here we are on Monday, and we are 1 week away from everyone in Massachusetts becoming eligible for a COVID-19 vaccine, 16 and older. Here to answer your questions is Dr. Mark Seidner, and he's an epidemiologist at the Department of Infectious Diseases at Mass General. It's great to have you with us, Doctor. Okay, we're talking about next Monday. Anyone 16 or older can book an appointment. Many of the people left in this final group have the lowest risk, and I use that term cautiously, for serious symptoms. So if someone is thinking maybe they really don't need the shot, why should they reconsider?
Yeah, well, I think you said it correctly. Lowest risk is not zero risk. There have been over 20,000 deaths in people under 50 in the United States from COVID-19 the last year. They've accounted for about 10% of deaths in people in their 40s and 5% of deaths from people in their 30s. So just because you're lower risk doesn't mean you're no risk of getting sick or dying. And of course, being young doesn't protect you from spreading the disease to others. So even if we aren't doing it for ourselves, getting vaccinated is the right thing to do for our loved ones.
All right. And Dr. Seidner, we now have a lot more real world data about the safety and efficacy that we did when this rollout started in December. Have you seen any reports yet that raise serious concerns about Pfizer, Moderna, or Johnson & Johnson vaccines?
I would say quite the opposite. Over 100 million Americans have now been vaccinated with one of those three vaccines. That's a sample size for which, if there were serious side effects, we'd have seen them by now. I think what we're seeing is some allergic reactions in about 1 out of every 100,000 people or so, and we know how to manage these. So I think the more data we've gotten, the more reassured we've been.
Let's talk about reality, and it is amazing how quickly we've even gotten to this point to get from the beginning of COVID to get vaccines into people's arms in this ridiculously short period of time, relatively speaking. So some people still believe this process has been rushed, and they want to wait for more long-term data. So what's your advice to people who are hesitant or skeptical because the vaccines are still so new?
Yeah, I think it's a good question, and I think we need to make a distinction here between fast and rushed. The technology that's been used to make these vaccines has been around for decades. It's not new. It was just waiting for an infection like COVID to come along and allow us to use that technology. Second, the U.S. government poured billions of dollars into this vaccine development exercise, and that's just not something that's happened with other infections recently. And I think lastly, and most importantly, these vaccines were evaluated the exact same way we evaluate all drugs and vaccines in this country. Early safety studies, large studies of tens of thousands of people to show that they work and that they work safely. And then a thorough external review by independent scientists to show that they are safe and effective. It went through all of those steps. It happened quickly, but it happened the right way. And I think we're very now experienced on how to do things like this.
That's very comforting. And Dr. Anthony Fauci spoke today about breakthrough infections. What are they and how often do they happen?
Yeah, so I think there's three things to remember. Breakthrough infections do happen. No vaccine's 100% effective, but there's three things to think about. One is, by and large, these are mild cases. There have actually been no reports in the clinical trials of people being hospitalized or dying after getting a COVID-19 vaccine from COVID-19. So these tend to be mild cases. Second of all, they almost all occur very early on. So the first couple weeks, the first few weeks after vaccination, when the immune system hasn't yet responded to the vaccine, that's when we see most of these infections. And then lastly, I think most importantly, these infections are often asymptomatic. So we're still studying how much people who are vaccinated can transmit to others, which is why we still say, for now, if you're vaccinated, you still need to mask up, especially in public and around other people that aren't vaccinated.
Dr. Seidner, thank you so much for your time. We greatly appreciate it.
You're welcome anytime.
Dr. Seidner.